You always think that aging is the reason why you wake up at night to urinate, sleep poorly, and feel exhausted. In fact, the real cause may lie in what you're doing right before bed every night, habits that seem harmless but are silently damaging your prostate health day by day. That's why I, Dr. William Harris, sincerely ask you to take a few minutes and listen carefully to the message in today's video. Because prostate enlargement doesn't come from age alone. In many cases, it's worsened by repeated nightly behaviors, ones you may not even be aware of. These actions cause inflammation, compress your bladder, disrupt your sleep, and make you wake up every morning feeling tired, irritated, and even helpless, not knowing how to improve things. But here's the good news. This condition can absolutely be improved if you understand the 7 most common mistakes before bedtime, which I will walk you through in this video. Some of them may surprise you, and especially at the end of this video, I'll reveal the most dangerous habit that almost no one notices. Yet changing it could be a major turning point in your prostate health. Before we begin, I'd love to get to know you a bit. Can you share your name and where you're watching this video from? It would truly make me happy to know who I'm walking alongside on this journey. Please drop a quick hello in the comments section below. If you find this topic helpful, don't forget to hit the subscribe button and turn on the notification bell so you won't miss any new videos I release each week. And if you have any health-related questions, especially regarding men's health or prostate issues, feel free to share them in the comments. I'll compile them and make specific videos to answer your concerns. Now let's begin with the first bedtime habit that may be silently harming your prostate every single night. Number 1. Drinking too much water at night, accidentally putting pressure on your prostate while you sleep. Drinking enough water is important, everyone knows that. But what many people, especially men over 60, don't pay attention to is that the timing of when you drink is just as important. As the evening goes on, your body's excretory function slows down. But if you continue to drink large amounts of water after dinner, or even have tea, herbal drinks, or take medication with a full glass of water right before bed, you're unknowingly making your bladder work overtime throughout the night. And if your prostate is already enlarged, this pressure becomes even more serious. As a result, you may have to wake up multiple times during the night to urinate. And what's worse, every time your sleep is interrupted, your body misses the opportunity to produce key hormones that help reduce inflammation and regenerate tissue, including prostate tissue. Chronic poor sleep not only leaves you tired and low on energy the next morning, but also interferes with your body's natural healing process. Many of my patients believe that drinking tea or warm water in the evening helps them sleep better. But they don't realize that this liquid builds up quickly, filling the bladder right at the time your body needs deep rest the most. The solution here isn't to reduce your water intake, but to adjust when you drink. Make sure you drink enough water throughout the day, and try to finish most of it before 6 p.m., then gradually cut down. And avoid drinking anything within 2 hours before bedtime. If you need to take medication in the evening, talk to your doctor to see if the timing can be adjusted to better fit your body's natural rhythm. A well-rested bladder allows the prostate to relax, reduces irritation, and helps you get a deeper, uninterrupted sleep. My friend, if you're still watching the video up to this point, I'm truly glad and grateful that you're taking your health seriously. Please leave a comment below to let me know you're still with me. And you know, there's a habit that almost everyone thinks is harmless and relaxing, but it actually reduces blood flow to your pelvic area, making it harder for your prostate to recover after a long day. What is it? I'll reveal it right now. Number 2. Lying in bed watching TV for too long, a relaxing habit that quietly harms your prostate. You may feel relaxed lying in bed, holding the remote and enjoying a few hours of screen time before sleep. But in reality, this habit is silently affecting your pelvic health, especially your prostate. When you stay in one position for a long time, blood circulation to your lower abdomen, where the prostate is located, is limited. Slower blood flow means less oxygen and fewer healing nutrients reach the tissues, slowing down inflammation reduction and cell repair. On top of that, the blue light from the TV screen reduces your melatonin levels, the hormone that helps you fall asleep and enter deep sleep. Without deep sleep, your body struggles to initiate natural repair processes, including those that calm an irritated prostate. In my clinical experience, I've noticed that many older male patients complain about nighttime urination and ongoing sleep disturbances, and they almost always admit to watching screens right up until bedtime. What they don't realize is that every extra hour spent in front of the screen is an hour their prostate loses the chance to rest and recover. The solution is to gradually change your device usage before bed. Set a limit on screen time, ideally. Turn off the TV and devices at least 30 minutes before sleep. Instead, try gentle stretching, deep breathing, or reading a physical book to help your nervous system wind down. These simple actions can make a big difference in your sleep quality and give your prostate a better environment to heal overnight. If you've been thinking that sitting still and relaxing is harmless, the next part may surprise you. A digestive issue that seems minor could actually be putting direct pressure on your prostate every night, and you might not even realize it. Number 3. Sleeping while constipated. Silent pressure on the prostate that few people realize. Many people think that having a bowel movement tomorrow is fine and see it as no big deal. But for older men, going to bed while still constipated can lead to unexpected consequences, especially when it comes to the prostate. When stool builds up in the intestines, the colon, which is located close to both the bladder and prostate, creates mechanical pressure on the entire lower abdomen. This pressure not only causes discomfort and bloating, but also directly compresses the prostate, increasing the urge to urinate and stimulating the bladder throughout the night. It doesn't stop there. When the intestines are full, there is less space for the bladder to expand. This means even a small amount of urine can create a strong urge to go, making you wake up repeatedly, thinking your bladder is full. In reality, the urine volume is very small, causing an uncomfortable feeling of incomplete urination that lingers through the night. Another factor that's often overlooked: chronic constipation reduces blood circulation in the pelvic region. When blood flow to the prostate is compromised, the organ's ability to recover after a long day is significantly impaired, especially in men over 60. To fix this issue, the first thing you need to do is pay more attention to your diet. Increase your intake of leafy greens, fruits like kiwi or prunes, and whole grains to help promote better bowel movements. Also, drink plenty of water during the day and take a short walk after dinner to stimulate digestion. If necessary, consider adding magnesium or fiber supplements to help you maintain a regular morning bowel routine, so your body is fully cleared out before bedtime. Remember, don't let your body go to sleep while still carrying waste. When your bowels are clean, your abdominal area becomes less cramped, reducing pressure on the prostate and helping you sleep better with fewer nighttime bathroom trips. But here's the thing, there's another simple action that takes only a few minutes. And if you skip it before bed, it could cause your whole night to be disturbed by pressure, discomfort, and insomnia without any obvious reason. Number 4. Skipping urination before bed. A small act that can cause big problems for your prostate. Maybe you've thought, I don't feel like I need to pee, I'll just go in the morning. But in fact, not urinating before bed is one of the most common mistakes, and one that silently harms the prostate more than most people think. When you skip that final bathroom trip, your bladder still holds some urine, even if it's a small amount. For older men, especially those with an enlarged prostate, this residual urine can create problems. It adds constant pressure on both the bladder and the prostate while you sleep, causing irritation, inflammation, and making you wake up more frequently to urinate at night. Moreover, holding urine overnight increases the risk of urinary tract infections, because stagnant urine becomes a breeding ground for bacteria, which can trigger inflammation and make urinary problems more complicated. In the long run, skipping this step increases the likelihood of incomplete urination, which is already a common issue among older men. It not only makes you uncomfortable and disrupts your sleep, but it also prevents your body from properly recovering during the night. The solution is simple but effective. Develop a consistent routine where you always use the bathroom before going to bed, even if you don't feel a strong urge. Take a few minutes to sit still, relax, breathe deeply, and give your bladder a chance to release all the urine that's left. This seemingly small action can significantly reduce nighttime urination and help you enjoy deeper, more restful sleep. My dear friends, if you're still watching the video at this point, thank you for patiently listening this far. I truly appreciate it, and I'm so happy that you're someone who's paying attention to your health and actively working to improve it. Please continue this journey with me. Let's keep going. Even if you've taken care of urinating before sleep, there's another hidden factor that might quietly ruin your night's rest and increase the risk of prostate inflammation. And that is the snacks you eat in the evening, which may seem harmless but actually carry many hidden risks. Number 5. Eating salty snacks at night. the silent culprit behind prostate inflammation. Evening snacks like potato chips, salted crackers, or sausages may feel tasty and relaxing. But few people realize that eating salty foods late in the day is one of the silent factors that irritate the prostate while you sleep. When you consume foods high in salt, your body retains more water than usual. This increases hydrostatic pressure on the bladder and prostate area, making you feel the urge to urinate more during the night and waking you up multiple times. Each time you wake up, your sleep is disrupted, and your body loses access to the deep recovery phases, the critical periods when inflammation is reduced. In addition, a sodium-rich diet contributes to high blood pressure, which weakens blood circulation to the pelvic area, where the prostate is located. When oxygen and nutrient-rich blood can't reach the area adequately, the prostate's natural healing and anti-inflammatory processes are significantly compromised. Many people have a salty eating habit without even noticing. Just a few chips, some processed cold cuts, or even a slightly salty soup at dinner can contain more sodium than recommended, gradually building up into a hidden burden on your urinary health. The solution is not to cut out snacks entirely, but to change what you choose. Opt for light, low-sodium, and naturally anti-inflammatory foods. For example, pumpkin seeds, ripe bananas, or a spoonful of unsweetened yogurt. These foods are easy to digest and beneficial for both sleep and bladder function. Also, get into the habit of reading food labels carefully. Many packaged snacks hide sodium levels you wouldn't expect. Remember, the effects of salt aren't felt overnight, but are the result of repeated habits. And you can absolutely reverse this trend with small changes starting today. However, no matter how healthy your food choices are, there's another factor that few people pay attention to, one that can press on the prostate all night long. It's the sleeping position you maintain night after night without ever questioning it. Number 6, sleeping on your stomach, an unconscious habit that can cause long-term damage to the prostate. Sleep posture is something few people pay attention to, but it can have a profound impact on health, especially if you regularly sleep on your stomach. For those already dealing with prostate enlargement, this is a silent habit that can worsen inflammation and pressure in the pelvic region. When you lie on your stomach, your entire body weight presses down on your lower abdomen, including the bladder and prostate. This mechanical pressure compresses blood vessels, reducing circulation, which is essential for prostate tissue to receive the oxygen and nutrients it needs to heal. At the same time, this prolonged pressure can also trigger nighttime urgency, causing you to wake up multiple times. Additionally, sleeping on your stomach can lead to spinal misalignment, tightness in the hips and pelvic floor, areas directly related to urinary function. Over time, this affects not just the quality of your sleep, but also causes symptoms like hesitant urination, interrupted flow, or a persistent feeling of incomplete voiding. The good news is, you can absolutely change your sleep posture in a way that supports your prostate health. Side sleeping, especially on the left side, helps improve lower abdominal circulation. Placing a small pillow between your knees helps maintain pelvic alignment and reduces pressure on the lower abdomen. If you often roll onto your stomach unconsciously, try using a body pillow or a barrier pillow to help maintain a better sleeping position. Sleep is the time when your body heals, and choosing the right posture not only allows you to rest more deeply, but also creates the ideal condition for your prostate to truly relax and recover naturally. However, sometimes it's not your body but your mind that's preventing your prostate from recovering during the night. And in the next part, we'll talk about a seemingly invisible factor, one that has the strongest impact on your sleep, immune system, and overall prostate health. Number 7, going to bed while stressed, the silent enemy of sleep and prostate health. The worst habit you can maintain before bedtime isn't about how you eat, drink, or sleep. It's about your mental state. Many people don't realize that going to bed with a mind full of stress, anxiety, or worry is the trigger for a chain reaction of harmful effects on the body, especially on the prostate. When you're stressed, your sympathetic nervous system gets activated. This is your body's fight or flight mode. It raises your heart rate, constricts blood vessels, and increases levels of cortisol, the stress hormone. Cortisol doesn't just cause insomnia, it also intensifies inflammation, including inflammation of the prostate. What's more, chronic stress weakens the immune system and disrupts hormonal balance, leading to low testosterone, one of the key causes behind prostate enlargement over time. The concerning thing is, many older adults go to bed each night carrying worries about their health, finances, family, or aging. and this prevents their bodies from ever truly resting. But the good news is you can break this vicious cycle with very simple actions. Just a few minutes of deep breathing, listening to soft music, writing in a journal, or practicing basic relaxation before bed can help calm the nervous system and guide your body into a deeper rest. And with just a moment of inner peace before sleep, your prostate will have the ideal conditions to begin healing through the night. Stress is an invisible enemy, but the consequences are very real. Fortunately, you can take control of it step by step starting tonight. Now that you know the 7 habits that seem small but have a powerful impact on prostate health, it's time to talk about what matters even more. Turning this awareness into consistent daily action. That's exactly what I want to help you with in the final part coming up right now. A prostate health tracking tool, a practical companion for men over 60. Before we continue, I want you to take a few seconds to hear something important. Because thousands of men over 60 have already taken proactive control of their prostate condition through a simple, effective, and accessible solution. Using a dedicated prostate health tracking tool. This is a specialized app designed specifically for seniors. It helps log nighttime urination frequency, sleep quality, pelvic discomfort, and reminds you to maintain healthy daily habits that support your prostate. Many of my patients have told me that, since using this app, they've found it easier to notice small changes, things they used to overlook. No need to keep written notes or memorize every piece of advice from the video. Just a few taps each day, and you'll understand how your body responds to each habit. This is especially helpful when you want to share your progress with your doctor to find the most suitable treatment approach. However, to ensure quality support and personalized feedback, the number of new users allowed each month is limited. If you're watching this video while registration is still open, consider installing it today, so you don't miss your chance to take long-term control of your health. And now, let's wrap up with the key takeaways from today, and help you clearly see how to move from awareness to action, improving your prostate health naturally, scientifically, and sustainably. Small changes can make a big difference for your prostate health. By now, you've learned the 7 bedtime habits that might be silently worsening your prostate symptoms. Habits that most men aren't even aware of. These aren't random tips. They're insights drawn from real-life experience with thousands of male patients over 60. Men who applied these changes and noticed real improvement. All it takes is gradually adjusting these simple habits. From the timing of water intake, device usage, evening snacks, sleep posture, to your mental relaxation routine. Once you do, your body will finally have a chance to recover naturally. Your bladder will be relieved of pressure, and your prostate can begin to calm down and heal more effectively overnight. You don't need to change everything at once. What matters most is understanding what's affecting you and then making small, steady changes in a way that fits your lifestyle and your current routine. With patience and commitment, your body will respond positively in ways you might not expect. But even if you understand all of this, there's still one final factor that determines whether your health will truly improve. And that is, are you ready to commit to yourself and your recovery journey starting today? Let me leave you with this final thought. Health is a gift and you deserve to protect it. There's something I always tell my patients. Your body doesn't demand perfection, only consistent care.